Since the 1950s, there has been talks about how to properly estimate the risk of cardiovascular disease. We know back in the 60s, there was a big push that saturated fats causes heart disease, and so we cut out all the fats and pumped everything with sugar. Well, when you have your lipid panel done and you have a high LDL, a lot of the times they'll say your LDL is high, increased risk of heart attack, stroke, cardiovascular event. Take this and it'll get better. What I look at when I'm looking at a lipid panel, I look at HDL, I look at triglycerides, and I also want to know what the particle size of the LDL is. If you haven't heard of particle size, you can have a lipoprotein test done. When we're looking at the lipoprotein, we're looking at small and dense. Think of small and dense sticks inside the arterial walls and can cause issues because small and sticky. If it is large and buoyant, it's not going to stick on the arterial walls, less risk of cardiovascular event. There was a study I was looking at in 2022, and it looked at 5,366 patients with coronary heart disease. When we are looking at an increased risk of cardiovascular disease, heart disease, we're looking at triglycerides with the density, the particle size. So when they were looking at fasting triglyceride levels and the density of the LDL, what they found was if it's less than 70, there was a lack of abundance of the small LDL. At 70, there was 4.2% of the small LDL. Less than 150, it jumped from 4.2 to 22.7%. So that could be anywhere from 71 to 50. And then when they looked at the triglyceride levels of 150 to 250, that jumped from 22.7% to 79.1%. And when triglyceride levels were over 250 milligrams per deciliter, it was 100% small LDL, which increases the risk. Now, there was another study that had, I believe, over 136,000 patients that were hospitalized. And that was conclusive of even when the LDL, just your normal lipid panel, that LDL was within normal limits, anywhere from 70 to, I believe, almost 140. So within that range, most clinics or hospitals, they will tag it as less than 130 LDL is within normal limits. Some is less than 100. So even when it was under 100, these people were still having cardiovascular events.